most congenital abnormalities of the spinal cord will occur during the 4th week of development of the embryo, and they are the result of abnormal closure or defective closure of the neural tube during that time period. So these are defects that affect the tissues overlying the spinal cord, meninges, which will result in meningocele or meningomyocele, vertebral arches, which will result in spina bifida, or even muscles and skin. Incomplete closure of the vertebral arches is referred as spina bifida. On the other hand, when it involves protrusion, the incomplete closure involves protrusion of a sac containing the meninges and cerebrospinal fluid, it refers to as spina bifida with meningocele. Myelo in this context refers to the spinal cord, and if the spinal cord included in that sac, the defect will be referred as spinal bifida with meningomyocele. So spina bifida is a neural tube defect. It's a congenital disorder, and again, in this case, one or more vertebrae fail to closure over the spinal cord. So there is an opening in the column, which in this case, the vertebra is essentially split in two. The cause of this, why it's happening, exactly not known, although there are several factors that certainly associated with this. It can be maternal radiation, exposure to X-rays, and genetic factors, virus, also maternal folate deficiency, where there is strong correlation with the spina bifida occurrences. It's important to supplement periconceptionally with folic acid, which can reduce the incidence of neural tube defects. And periconceptually means that pretty much every female that has some slight risk of conceiving should use folic acid supplementation. So folic acid supplementation will help to reduce the incidence of neural tube defects. Spina bifida occulta is one of the most common forms, or the most common form of spina bifida. In this case, spina bifida is present, but it's asymptomatic and hidden, occult. Signs of this malformation will include dimpling of the skin and a tuft of hair or port wine nevus on the skin surface above the defect. So meningocele again happens when meninges of the spinal cord protrude through the opening of the vertebral column, and they will again form fluid-form sac on the skin surface. And because nerve tissue isn't involved, the infant won't have really neurologic problems. On the other hand, myelomeningocele is much more serious because the meninges and a portion of the spinal cord, as I said, protrude through the opening in the vertebral column, and this is causing neurological symptoms. So depending on the type and cause of the neural tube defect, a patient may experience skeletal malformation, deformed joints, paralysis of the leg, bowel and bladder incontinence. So how to diagnose this? The condition is suspected again when there is a skin defect like port wine over the spinal area, and muscular abnormalities in the legs and feet. And diagnosis, of course, can be confirmed by imaging studies, or myelography also can be performed. Surgical intervention needs to be performed, and usually performed within 24 hours of birth. And patient may need, or the baby may need, additional interventions while child grows. And unfortunately, some of the children were not able to walk, and mortality is relatively high before age of 2 or 3. Again, the only established link for prevention of spina bifida formation is the pre-conceptual supplementation with folic acid. Cerebral palsy is a congenital bilateral paralysis which may result from inadequate oxygenation or hypoxia of the brain during fetal development, or during the delivery of the child, or sometimes it's speculated that the hypoxia may occur early in the infancy. Cerebral palsy is most common disability in children, and it certainly affects more premature babies, and it's more prevalent in male babies. The causes for this are birthing difficulties, such as prolonged labor, maternal rubella, toxemia, hypoxemia, and one of the causes that established its asphyxia from the umbilical cord wrapped around the neck, and head trauma, meningitis. But quite often it's not possible to establish the cause of cerebral palsy. So disorder will usually affects the motor and muscle performance, and it may be noticed that the infant cannot swallow or suck very well. Other complications may be visual and hearing difficulties, seizures, and cognitive development delay. Reflexes can be hyperactive, and contractions of the muscles may occur quite rapidly, and at the same time muscle can be weakened. Muscles are weakened, and child may have abnormal gait like scissors gait, and it will be exhibited by toe walking and crossing one foot over the other, which when they step forward. How to diagnose this? Diagnosis based on clinical pictures, picture which is evaluation of the posture, more motor patterns of the child, and muscle tone and tendon reflexes. Unfortunately, there is no cure for cerebral palsy, and the treatment may involve physical therapy, speech therapy, casting of orthopedic casting, braces, and surgical interventions that may help to correct abnormalities to some extent. If patient has seizure disorders, or may benefit, then patient may benefit from anticonvulsant, and sometimes muscle relaxant may be prescribed in this case.